Being a salon professional is fun and rewarding, but it also carries a great responsibility. One careless action could cause injury or infection, and you could lose your license or ruin the salon's reputation. Fortunately, preventing the spread of infection is easy if you have learned what to do and practice this at all times. Remember that safety begins and ends with you. Infection control is the method used to eliminate or reduce the transmission of infectious organisms. Contaminated salon tools and equipment may spread infections from client to client if the proper disinfection steps are not taken before and after every client. If clients are infected or harmed because of a service or infection control procedure that is not performed correctly, you may be found legally responsible for their injury or infection. In 2000, over 100 clients at a California salon had serious skin infections caused by Mycobacterium. This is a microscopic organism that normally exists in low concentrations of tap water. The infections caused stubborn, ugly sores that lingered for months and required the use of antibiotics and in some cases left permanent scarring. The source of the infection was traced to the salon's Whirlpool foot spas. The salon staff did not properly clean the foot spas, leading to the outbreak. Staph infections, such as the one that causes MRSA, although resistant to most antibiotics, are easily protected against in the salon with proper cleaning and disinfection procedures. Never perform a service on a client that shows signs of infection or other unhealthy conditions. A fungus infection such as ringworm can be spread through dirty implements and improper cleaning and disinfection procedures. Fungal infections are more common on the feet but can occur on both hands and feet. This type of infection can easily spread from client to client unless everything that touches the skin is either properly disposed of or properly cleaned and disinfected before reuse. A virus such as the common cold is one example of a contagious disease that is easily spread from person to person. Other types of viruses that are common to the salon are HPV, hepatitis, and influenza. Dirty implements, foot baths, and improper cleaning and disinfection are one example of how these viruses are spread. A wart is caused by a highly contagious virus. However, preventing the spread of warts is easy to accomplish by proper cleaning and disinfection procedures. Clients with warts should be referred to a physician for diagnosis and treatment. Prior to her vacation, this client received a pedicure in which the technician used dirty implements and accidentally cut the client's toe. By day 2, the client was in the emergency room, and by day 3, the client was hospitalized. Day 4 shows just how dangerous unsanitary practices can be in the salon. The first step of any infection control method is to clean. Scrubbing using soap and water or detergent and water to remove visible dirt, debris, and many disease-causing germs from tools, implements, and equipment. The vast majority of contaminants and pathogens can be washed away from the surface of tools and other implements through proper cleaning. Be sure to thoroughly rinse away all traces of soap and place in a hospital-grade disinfectant for 10 minutes. Cleaned surfaces can still harbor small amounts of pathogens, so the second step of infection control is disinfecting. Disinfection is the chemical process that uses specific products to destroy organisms on non-porous surfaces. This process requires the use of an EPA-registered disinfectant prepared and applied following the manufacturer's instructions. All surfaces must be cleaned prior to disinfection. The Center for Disease Control has published guidelines called Standard Precautions that require professionals to assume that all human blood and bodily fluids are infectious. Because it is impossible to identify most clients with infectious diseases, always use the same infection control practices with all clients. Practice infection control at all times. You never know who will be the next person to use that foot bath or that manicure table. It could be you.